Today we'll discuss lump basics, blood, class 3, part 3. Okay. Blood is a good example to illustrate the duality of yin and yang. Blood is yin because it is fluid, it carries nutrients, it nourishes the whole body. Blood is yang because it is flowing, it circulates warmth, and any part of the body that does not receive blood would become cold. If any part of the body has excessive heat and has no possibility to control this heat within, then it would need to expel it outwards. The quickest and most efficient way to achieve this is by bleeding. Bleeding releases and reduces heat. Yun, bleeding. Okay? So this is the illustration of the kung paano nagtatransform at nagtatransform from food and the drink, kung saan siya napunta, sa stomach, and then yung sa spleen, magkasama sila, at saka yung kidney or bone marrow, with the air, sa lungs, and the heart. So dito mamaya, iaano natin sa next slide, i-explain po. Okay? So, blood metabolism or blood zoo. The above picture shows the roles that different organs play in blood synthesis. The stomach receives nutrients and fluid from what we eat and drink. These are digested and separated into pure and impure substances. The spleen absorbs the purer form of nutrition and stores some of it. It sends the rest of the absorbed nutrition down to the kidneys. Yung kidneys naman make bone marrow, which make blood. This blood is without nutritional value and is called white blood or plasma. Nutrients and fluid from the spleen and the white blood to the lungs. The lungs also contribute to the nutrition of blood by breathing in oxygen. Thus, all the necessary nutrients reach the thorax, and red blood or the oxygenated blood is synthesized by the heart. Okay, yun po yung explanation ng picture na yon. As we can see, anemia or blood deficiency may be nutritional problem. Yun yung iron deficiency. It could also be due to many other reasons. The most obvious being weak heart yin and yang. It is called heart blood and Qi deficiency. When treating, it is necessary to tonify both the yin and yang aspects of the heart, improve nutrition, and use master points. Remember these points. UB17 for blood and GB39 for bone marrow. Okay? The liver is an organ that holds the blood within the vessels and within itself, thus governing, storing, and letting go of blood through the bleeding. Liver yin stores blood, and liver yang releases the blood. Okay? This patient has thin blood. Ito yung towergram. He does not bleed spontaneously but has problems with blood coagulation. If the patient had an injury, he would continue to bleed. Maliit. Hindi sila pantay yung yin and yang niya. Yung mataas yung isa mababa. So, ito naman sa second towergram, in this case, there is a tendency for spontaneous bleeding as the liver yang is high and it releases blood. Okay. The next towergram, spontaneous and excessive bleeding. This is the worst combination that there could be the liver. On the other hand, the yang wants to release the blood out of the vessels. On the other, the yin cannot store it in the vessels. Okay? So naman yung last towergram, yung parang tuldok-tuldok, there is problem. So may problem related to release of blood when it is necessary to bleed. For example, menstruation. Okay? Women with liver Qi or function deficiency often suffer from dysmenorrhea at onset of menstruation until the blood starts flowing freely. The blood tends to stagnate in the uterus, thus causing severe cramping pain and dark clotty bleeding. With all the cramping and spasm, the liver Qi eventually improves enough to release the blood flow, and this eases the pain. The dark clotty bleeding suggests liver blood stagnation because of Qi deficiency. Okay?